So, North American world premiere of the Intubating LMA.
Matthew Thomas.
Rising Airway star, or model, action.
I'll take model.
So this Rescue Oxygenation device that he's holding in his hand, first time in North America video, basically way different shape and setup, right? One looks like a phallic symbol, one looks like a receiving symbol or device, right? Both are rescue oxygenation devices. Now I need to preface this, that this device is the evolution of these three devices, right? This was a King LT, not for intubation, unless you had like a specialized pediatric intubating device with a FROVA or an entry catheter that allows for fiberoptic scope to go in through a intubating bougie. But this device enables you to use fiber optics. So we're going to demonstrate if this device, that this is a size 4/5 intubating laryngeal tube, is going to work, at least on a mannequin, and next on a cadaver, hopefully soon. All right, so we're going to insert this like how we traditionally insert.
Cool.
Now the guidelines and the instructions, that you still have to do the awesome jaw pull. All right, and then you insert. Your insertion lines are going to show somewhere between 4 and 5. I think the majority of the teeth lines are in the red area of like 4. And then you have a Q, and the Q shows for red 70 cc's to inflate. So we're going to inflate. Now you're going to notice the device is going to accommodate. And it just rolls slightly. You don't push it back. It's just accommodating to the soft tissue downward. All right. Now we're going to confirm placement with end-tidal CO2, with chest rise, which we always don't get on these simulation mannequins. So, all right. So there is some chest rise or some lung expansion, and hopefully our alignment is good enough to use the fiber optic scope. Interesting enough, since this tube is not curved in this manner, we don't have to overly extend. This device is pointing directly vertically. So this is probably going to allow you to intubate from behind, right, like a drop. So a lot of people, get taught how to use this intubating fiber optic scope, A-scope, and with this device, you can still go up, down. I think you can actually keep your hand up if you want. Relax it. And what do we see here? And hopefully we can see something that looks close to north. There's a crevice. That crevice looks like glottic opening. Go a little south. Will it be this easy? Will it be this easy? Okay. Karina. Now we gotta push that in. So we're pushing in what, a 7.5?
We're pushing in. Yep, 7.5.
All right. So now we're gonna advance this. Disengage. You want additional lube or?
No, it's fine. It's going in.
Remember, it's about to enter. Does add more lube? Push. Little resistance, I think, right?
And there's the kind of right,
right there. See it right there. So pull back the ET tube a little bit. Tight fit. All right. So I'm going to ask, how long can you keep this King LT in? You're going to get venous and lymphatic engorgement of the tongue if you leave it in with the King LT. There's a rescue operation that we're doing, procedure. So pull back. We're in. We're going to do the shin method again. Of course, in real life, we would have inflated the cuff, bagged, make sure the sats were up for 1 or 2 minutes, and then gone to the exchange. All right? Don't fall in love with the intubation part without oxygenation. Go as far as you can with the coude tip down.
Yep.
Okay.
Okay.
Now we got to deflate. So far, so good. I'm going to pull off both devices. I know it's counterintuitive, and people are going to say, why are you doing it? I'm listening to Richard Chin, because out of practice in this mannequins, it works best. And I think logically it'll make sense. So now we just got to put an 8.0 ET tube. You want your 8.0?
Yes, I don't think that was the 8.
No.
8.
You have your 8? You have an 8 with a cuff on it? Here.
Oh, thank you.
No problem. All right. Hopefully he doesn't have to do the jaw pull and uses his thumb to articulate with the epiglottis. He may have to. I really don't want to. It's like the Borg. Resistance is futile. Okay.
Cool.
All right.
2.
So we need to confirm that it's still in with an expensive device. Let's do that.
Fancy.
We got it. We used it. One-time use. It's his own microorganisms. Is it in? 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 Oh, a little deep. Pull back. Oh, Carina's there. Bye, Carina. Let's go pull back slowly. Good. Let's go just venture backwards with the scope.
Oh, there's the opening.
World premiere, North America. SimLab program. The program proves that it works. All right. Not so bad, not so hard.
Not so bad. Not so bad.
Next time, Cadaver Lab.